Hello people, in this video let us look at transient loss of vision, amaurosis fugax it is called as. What are the causes? So what are the causes of what? Amaurosis fugax. So what is amaurosis fugax? It is transient loss of vision. So they see sometimes, when it becomes fine, then again they don't see, they see. So this can happen in carotid artery disease, papilledema, giant cell arteritis, okay, migraine, Raynaud's disease, severe hypertension and prodromal symptom of CRAO. So why does it happen, let us say, in papilledema that people cannot see? Actually, they are saying that they can see it sometimes and they cannot see it sometimes. Why does that happen? In papilledema, because of raised intracranial pressure, they gave a history of recurrent attacks of transient blackout of vision, amaurosis fugax. Because of raised what? Intracranial pressure. And then probably it subsides and they are able to see again. What is the reason that they are able to see again and again it happens? And carotid artery disease, guys, they're talking about carotid artery disease. So let's just understand where the carotid artery is here, right? So some problem with this, and again it looks like the blood supply is affected. Migraine, what happens? Vasodilation happens, isn't it, in migraine? That's why I think in migraine they are giving you sumatriptan, etc., right? Which can, this one, which can constrict, which can cause vasoconstriction. Remember, migraine, you have ergotamine, dihydroergotamine, sumatriptan and rizatriptan as the drugs for anti-migraine. These are specific anti-migraine drugs. Which of this? Sumatriptan and rizatriptan. What is Raynaud's disease? This is also something to do with the arteries, right? Blood supply. So that is when it is happening. Excessive constriction in response to cold, etc. Limiting blood supply to affected area. This kind of makes sense. That is why there is amaurosis fugax. That is transient loss of vision. So I think this is what you can remember. Then here, what did you see in migraine? There is dilation of cranial blood vessels, they said, right? Then papilledema also puts some pressure, right? Pressure due to intracranial pressure, right? So there is pressure, intracranial pressure. So that itself summarizes pressure. So then, so this intracranial pressure will cause transient loss of vision. And here they are saying artery, so that kind of makes sense. So the artery itself has issues, so blood supply affected. Then severe hypertension also will affect spasms. I think if especially spasms, then you can have transient loss of vision. Prodromal symptom of CRAO, that is central retinal artery occlusion, again artery, right? So in the prodromal part of it, right? Initial part of this central retinal artery occlusion, you can have transient loss of vision, amaurosis fugax. Do you remember this central retinal artery occlusion? In this, what did you see? Is there something called as, there will be emboli, okay, that will block Hollenhorst plaque. All that will cause blood supply issues, right? So this person will have amaurosis fugax. Who? The central retinal artery occlusion, guys. So just remember, everything is to do with blood almost, right? Papilledema, don't forget. You forget anything, but don't forget papilledema, okay?